In recent years, the NHS has been faced with some of its biggest challenges and a growing need to explore new and improved ways of working. In 2015, the National Vanguard programme offered the opportunity to trial a new way of working in Hampshire. Covering a population of over 1 million people, the programme became known as Better Local Care.
Better Local Care started about 3 years ago when we entered the Vanguard programme. What we did was we bid to work together as GPs with the community provider, with the local authority, with patients, with voluntary groups, to look at developing new ways of delivering care for our patients.
We've listened to all the problems, we've allowed people time to tell us what's important to them, what matters to them, and by listening to them we've been able to come up with the solutions that have improved health of our local populations.
Across the region, 12 localities or natural communities of care worked with local partners and service users to design and test new ways of providing integrated out-of-hospital care. Projects were different in each locality, reflecting their own local health and care priorities, but they shared a set of common goals. To improve access to GP and primary care services, meaning it will be easier for people to get a same-day appointment with the right professional and freeing GP time to support people with complex needs. To provide specialist services closer to where people live, in GP practices, community hubs and at home. This will make it easier for people to access the care and support they need more quickly and reduce the need for people to go to hospital unnecessarily. To simplify the care people receive by joining up health and care professionals that support the same people. This is particularly important for people with complex and long-term health needs who often have a lot of different people involved in their care at a different time. To support people to look after their own health and well-being, meaning that people stay safe and well in their own homes for longer and are more confident to look after their own health and care needs. These projects delivered both successes and learning for local teams. Examples of real improvements for local people included an increased capacity in GP practices, making it easier to be seen more quickly by the right professional. More support and care for people with complex needs in the community, meaning fewer avoidable hospital admissions. High levels of service user satisfaction, with new services that are easier to access and designed around their needs. Increased levels of service user well-being and confidence to manage their own health and care needs. Increased support for primary and community teams to help manage the increasing demand for care. Important as these statistics are, the most important feedback is from our service users themselves.
My name's Joy. I live in Gosport, have done for about 24 years now, and I use the GP Same Day Access service. Each time it's been extremely efficient, extremely professional.
Good afternoon, are you for the GP Same Day Access service?
And every time it's been incredible to actually see a doctor on the same day or have the symptoms dealt with on the same day.
Come this way, Joy, come and take...
I think the ethos of having a team coming from an acute hospital to the actual surgery is a fantastic idea. Otherwise, people will be making probably 5 or 6 visits to an acute hospital to get the same results as they got here in one afternoon. I think it's a win-win situation.
Well, not too bad, good days and bad days.
With my experience, if I come across anyone who recently had a family, a relative being diagnosed with Alzheimer's, I'll definitely thoroughly recommend them to contact the signpost, because it's been so invaluable, the help they've given me. And I came in very, very stressed and very depressed, but even with the first interview, I walked out with my head a bit higher, thinking, yes, there is help.
The Vanguard programme is coming to an end this year, but the journey is far from over. Local systems in Hampshire are pushing forward with a new model of integrated out-of-hospital care that is built on the Better Local Care philosophy, and which applies the learning and successes from Better Local Care to reach even more people.
Taking this forward, this has given the system here a belief that we can come together, and a belief that if we do actually bring local leadership together, bring the patient groups together and listen very carefully to each other, we can do extraordinary things.
What's happened since we started is that we've got these things called STPs, which are about transformation and partnership working. And the biggest thing for me, apart from all the services we can define, is the cultural change. The culture about can do rather than can't do because, which all comes out of the legacy of better local care, essentially.
We would like to take this opportunity to say a huge thank you and well done to all our health and care partners, the charitable sector and our service users in Hampshire for their contribution and commitment to the Better Local Care programme. We look forward to continuing this work with you.